Hey guys, this is Tara Macklin. I'm hopping in here to talk to you guys about another PCOS myth, with this being PCOS Awareness Month. And what I'm going to bring up today is hysterectomies. I've actually seen this popping up more and more in different PCOS groups, and so I really wanted to hit on this because I do feel like we were designed for our body to work well together. And really, our bigger problem at the end of the day is all the things that we invite to our body. So, all the things that are surrounding it. And I don't think that our bodies were created to be dysfunctional, so to speak. So, I want to put some thoughts into your brain or in your mind about if this is an option for you. One, if you have something by far more serious going on than PCOS, by all means, definitely chat a little bit more with your physician about a hysterectomy. Really understand what they think is going to happen by removing your uterus. I know many PCOS women, we struggle with heavier cycles. We maybe have some pain either during our cycle or throughout. So that might be some reasoning why your gynecologist, your OBGYN, might be bringing up this as a solution. However, remember, PCOS is not a reproductive condition, as you might maybe not be aware. I don't know, but it's actually more of an endocrine or metabolic disorder. So there's bigger pieces at play here than just the flow of your cycle when it comes to your PCOS. Remember, there are many different drivers that promote PCOS in our body, whether it be high androgens. You could have am I blanking? Inflammation. You could have insulin resistance. All of them kind of circulate around in each other and kind of cause the other thing to happen, so to speak. But you usually have one primary driver that just kicks PCOS off for you, and it's not necessarily because you have a uterus. So we want to try to focus on taking care of the driver or the driving force for our PCOS before we start talking about removing our uterus. So one thing, if this is your OBGYN, please consider getting a secondary opinion. Truly understand why they feel like this is like your last resort, and it should truly be your last resort. Again, unless there's something else deeper going on beyond your PCOS. But if we're just talking about PCOS, please go get a second opinion. And guys, if we're removing any body parts, truth be told, please go get a second opinion. I mean, again, make sure that we're kind of all on the same page, that this is the appropriate next step for you, because there are repercussions to losing your uterus. Also, understand there's multiple types of surgery that could happen here. You could be just losing your cervix. You could just be losing your cervix and your uterus, or they could just take out the whole enchilada and also remove your ovaries as well. So be also aware of what exactly is going on in procedure here. But usually what we're talking about is hormonal balance and the disorder of that balance. And if your ovaries are still intact, which many of us with PCOS will still have our ovaries left, they don't remove that part, then we need to come to understand that the whole problem, and not that our ovaries are the whole problem, but a big part of how our endocrine system works and what's causing our problem is still there. It's the ovaries. So trying again to work on the changes that you need. If we have too much androgens, then we need to talk about what our DHEA levels are, and potentially if it's the testosterone or something else in the androgen family, then what is that needs to be worked on? If it's stress management or getting our testosterone levels lowered, what does that need to look like? If it's things in our lifestyle with the food that we eat and the products that we use. I know you guys probably just don't like being told how do you live your life. You want to live it like everybody else. But guys, I'm telling you, if you don't learn to manage that stress, you're going to be in the same place. It's never going to change. If you have insulin resistance, then finding that balance in your food should be one of your primary pieces to this puzzle, and trying to get that balanced out. I know insulin resistance is tricky, but sometimes when you get that uterus removed, you actually are going to spike up that insulin resistance, and even more so when you go and remove your ovaries. So something to keep in mind, PCOS doesn't go away. In fact, PCOS doesn't even go away during menopause, which when you're removing those body parts, you're literally putting your body into menopause. So if you have inflammation, if that's one of your drivers, then, you know, talking about healing your gut and removing the foods that are inflammatory for you, and again, the products that are inflammatory for your body, to help get those levels back down to normal. Those are things that you want to address and work on diligently before we start talking about this removing body parts concept. So in looking over some of my notes, and a lot of this stuff is actually coming out of the American College of OBGYN. So just so you guys like don't think I'm making this stuff off the top of my head. There's a lot of things that in here literally talking about and reiterating the things I just talked about in here. Other problems that may arise, you lose your uterus, and I will tell you, not from personal experience because I still have mine, but I've definitely talked to other women who have, and their response to sex just changes. So if that's something that you do enjoy, that's something to consider before having it removed. So making sure I'm not missing anything. So testosterone levels, again, having a hysterectomy won't clear up your acne. So again, a lot of women are usually doing this because they have painful flow, heavy flow, all those kinds of things. And the theory is removing that will help eliminate that. Well, yes, you're eliminating your cycle, but you're not eliminating the driver for the other symptoms you might be having. So bear that in mind. I think the last thing that is just understanding that those surgeries have some consequences to them. So if you don't need to have a surgery, trust me, you don't want to have an unnecessary surgery, especially if having it removed is not showing a lot of positive signs, even in the OBGYN community, that this is going to be an effective treatment for you. It's really a roll of the dice, and it's for me, the risk would definitely outweigh the benefit of having a cycle issue. So there are definitely types of birth control that can shut off your cycle if you've not tried those, and that's something that you're seeking out. Talk to your doctor about maybe needing to work on progesterone levels and things like that to maybe make your cycle a little bit more smooth. That's just one of the suggestions that has come from the American College of OBGYN. So just some food for thought to put out there for you guys. Please don't just jump into a surgery. Do some homework. Do some, I mean, guys, PubMed, Google Scholar, like those have some great research articles in there. If that's your jam, go talk to another medical professional, 3 or 4 of them, and get a consensus of what that needs to look like. But again, I really highly suggest having that talk with an endocrinologist, someone who this is metabolic conditions, endocrine disrupting conditions. This is their jam. So with that said, hopefully you guys have found this helpful, giving you some food for thought and consideration when looking into a hysterectomy. If you guys have any questions, I have all my contact information below, and I'll definitely help you kind of walk through where I've come up with my information for this video. So I will talk to you guys again soon. Bye-bye.